You're about to take on a 5-hour NCLEX-RN challenge that simulates real exam pressure. Inside, you'll face complex case studies, clinical judgment scenarios, tricky SATA traps, timed decision-making, safe dose calculations, highlight and drag and drop questions. But here's the twist. We're not just testing you. We're training your brain to think like the NCLEX wants you to. After every question, we break down the logic, the traps, and the best test-taking tactics, step by step. Why is this different? Because you won't just memorize, you'll master. You'll stop second-guessing, you'll know why you're right and exactly where you went wrong. Let's build the kind of confidence that walks into the testing center and walks out licensed. Let's go. NCLEX drag and drop scenario. A nurse is caring for a 55-year-old male patient who has been admitted with chest pain. The pain just started an hour ago and is suspected to be due to a myocardial infarction, or in everyday words, a heart attack. Now, here's a bit more about our patient. He has a history of type 2 diabetes mellitus and has been smoking for the past 20 years, about a pack a day. Given all this, the nurse needs to act quickly and wisely. Based on what you know and what's going on with this patient right now, which 3 interventions should the nurse prioritize immediately to help stabilize him? Let's look at the options on the screen. Options: administer oxygen, obtain a 12-lead ECG, administer aspirin, start insulin drip, provide smoking cessation counseling, order a chest x-ray, administer IV fluids. And here's the drag and drop portion with 3 blanks. I'll give you a moment to read through the question again and think about what you would choose. Imagine yourself in that patient's room. What would truly make a life-saving difference in those first few minutes? Okay, ready? Let's talk through the correct answers. Correct prioritized interventions. 1. Administer oxygen. 2. Obtain a 12-lead ECG. 3. Administer aspirin. Explanation. 1. Administer oxygen. When a patient is having a suspected heart attack, especially if they're showing signs of poor oxygenation, like low O2 sats or trouble breathing, oxygen becomes a lifeline. It helps feed the struggling heart muscle with the oxygen it desperately needs. If the oxygen saturation is below 90%, or if the patient is in distress, oxygen is your first go-to. 2. Obtain a 12-lead ECG. This step is absolutely critical. The ECG tells us what kind of heart attack we're dealing with. Is it a STEMI, ST elevation myocardial infarction, or something else? This helps the entire care team decide whether the patient needs emergency intervention, like a cath lab procedure or thrombolytics. And by the way, NCLEX loves this. The ECG should be done within 10 minutes of arrival for chest pain. 3. Administer aspirin. Think of aspirin as your clot buster's assistant. It helps stop more platelets from gathering and forming a bigger clot. It's a simple little tablet, but it saves lives by preventing the heart attack from worsening. Giving this early is standard MMI protocol and improves survival. Why the other options can wait. Start insulin drip. Yes, he's diabetic, but unless his blood sugar is critically high, this is not your first priority in a cardiac emergency. Provide smoking cessation counseling. Absolutely important for the long run. But right now, he's in an emergency. You can talk about quitting smoking after he stabilizes. Order a chest x-ray. Could help rule out things like pneumonia or pneumothorax. But again, in an MI, your ECG comes first. Administer IV fluids. This depends. If the patient is hypotensive, it might be useful, but giving fluids to a heart that's already struggling can actually cause fluid overload, so you'd hold off unless it's clearly needed. In summary, when seconds matter, you want to support oxygen delivery, get that ECG to diagnose fast, and give medications that prevent further damage. And that's exactly what oxygen, ECG, and aspirin do. All right, let's take a little trip into pediatrics. Picture this. You're a nurse assessing a 4-year-old child during a well-child visit. Everything seems calm. The kid is playful, maybe even a little shy, but mom or dad is there by their side. Now here comes your clinical judgment moment. Here's the question. Which of the following findings indicates a normal developmental milestone for this age? Let's take a look at the options that pop up on the screen. Options. A. The child can hop on one foot for several seconds. B. The child can read simple sentences independently. C. The child can solve basic addition problems, like 2 plus 3. D. The child can tie shoelaces independently. Take a moment to imagine this 4-year-old. What would you expect them to do confidently at this stage? What might still be a little beyond their developmental reach?
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX-RN. I know how stressful it can be, especially when you're balancing everything, clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX-RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and most importantly, help you feel more ready. Good luck. You've got this.
Okay, let's go over it together. Correct answer A. The child can hop on one foot for several seconds. Why this is correct. At around age 4, a big milestone is the development of gross motor skills. And one of the hallmark signs? You guessed it, hopping on one foot. It's a sign their balance, coordination, and muscle strength are right on track. It may seem small, but this simple action tells us a lot about their neuromuscular development. Let's look at why the other choices aren't quite right yet. B. Reading simple sentences independently. At 4 years old, children may recognize some letters or even their name, but full-on reading sentences on their own. That's typically a first-grade milestone, so around 6 years old. C. Solving basic addition problems, like 2 plus 3. Math concepts like this don't usually kick in until age 6 to 7, again, early elementary school. At age 4, children might be learning to count, but actual arithmetic is still a few years away. D. Tying shoelaces independently. This is a fine motor milestone that often develops around age 5 to 6, once their hand coordination and dexterity are a bit more mature. At age 4, they might try, but most kids are still relying on Velcro shoes or adult help. Final thoughts. When you're assessing a 4-year-old, remember they're active, they're imaginative, and they're developing fast. But they're not quite in school mode just yet. Think gross motor, basic communication, and early self-care, like dressing with help. Safe blood transfusion practice, NCLEX style. Let's step into the shoes of a nurse preparing to give a blood transfusion to a patient with anemia. This is one of those clinical moments where precision and attention to safety can make all the difference. Here's your question. Which actions ensure a safe transfusion process? Select all that apply. Now here are the options that pop up on the screen for you to think about. Options. 1. Verify the client's identity with another nurse. 2. Check the blood type and RH factor on the blood bag. 3. Administer the transfusion over 30 minutes. 4. Assess vital signs before starting the transfusion. 5. Use a 22-gauge needle for IV access. 6. Monitor for transfusion reactions during the first 15 minutes. I'll give you a moment to go through these. Think about your clinical priorities. What keeps the patient safe? What prevents complications? Ready?
Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the next-gen NCLEX-RN Practice Question Bank, Big Book of Question-Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next-generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions.
Ready? Let's go through them together, one by one. Correct answers 1, 2, 4, and 6. Let's talk about why these are the right choices. 1. Verify the client's identity with another nurse. This is a critical safety step. Blood is a high-alert medication, and verifying identity with a second nurse ensures the right patient gets the right blood. It's not just policy, it's about protecting lives. Double checks save lives. Check the blood type and RH factor on the blood bag. Compatibility is everything when it comes to transfusions. A mismatch in blood type or RH factor can lead to severe, even fatal, reactions. You want to look? Then look again. This is non-negotiable. 4. Assess vital signs before starting the transfusion. This is your baseline. You need to know where the patient stands before the blood hits the IV line. If something changes, fever, chills, hypotension, you can spot it early because you knew the starting point. 6. Monitor for transfusion reactions during the first 15 minutes. This is the danger window. Most serious transfusion reactions happen within the first 15 minutes. So don't hit start and walk away. Stay, watch, ask how they feel. Be present. Why the others are not correct. 3. Administer the transfusion over 30 minutes. Whoa, way too fast. Transfusions should usually be run over 2 to 4 hours. Going too fast puts your patient at risk for fluid overload or acute hemolytic reactions. Unless it's an emergency situation with provider orders, slow and steady wins here. 5. Use a 22-gauge needle for IV access. Too small. Blood is thicker than normal fluids. A 22-gauge needle just doesn't cut it. It can hemolyze red blood cells or slow things down. For adults, you want an 18 or 20 gauge to allow proper flow. Blood transfusions are high-stakes moments in nursing. They require sharp focus, great teamwork, and a deep understanding of protocol. It's not just about hanging a bag, it's about protecting your patient at every step of the process. So when you walk into that room with a unit of blood in hand, remember, double-check everything. Stay with your patient, know the signs. You're not just giving blood, you're giving life safely. Dosage calculation, IV drip rate. Okay, nurse friends, put on your math thinking caps. You're on shift, and you're preparing to start an IV infusion. The provider has just ordered 1,000 milliliters of 0.9% sodium chloride to be infused over 8 hours. You're using an IV set that delivers 15 drops per milliliter, known as the drop factor. And here comes the big question. What is the required drip rate in drops per minute? The options you see on the screen are A, 22 drops min, B, 31 drops min, C, 38 drops min, D, 45 drops min. I'll give you a moment to pause and try working through the math on your own. Grab your calculator or just think it through. Remember, drip rate is life in motion. Ready? Let's walk through it step by step like a calm and confident nurse would. Correct answer B, 31 drops min. Let's break this down in a simple, manageable way. Step 1. Figure out how many milliliter per hour. We're giving 1,000 milliliters over 8 hours. 1,125 milliliters per hour. Nice and smooth so far. Step 2. Convert to ml per minute. To get the minute rate, Kirtana run in 25 milliliters, or 60 minutes, 2 point. If you're doing great, hang in there. Step 3. Multiply by the drop factor. Now take that 2.083 millimin and multiply by the drop factor, 15 drops per milliliter. 2.083 times 15 equals 31.25 drops per min. Since you can't give a quarter of a drop, you round down. Yes, down. We don't want to overinfuse. That gives us 31 drops per min. Why the other options are incorrect? A. 22 drops min. That's too low. Your patient won't get enough fluids on time. Underinfusion can lead to complications like dehydration or delayed med delivery. C. 38 drops min. That's pushing too much too fast. Overinfusion can lead to fluid overload, especially risky in patients with cardiac or renal issues. D. 45 drops min. Whoa, way too fast. This would run through the whole bag in less than 8 hours. Definitely not safe. Dosage calculations aren't just about getting a number. They're about getting it right. Because behind every IV line is a real person, depending on you to deliver safe and accurate care. So next time you see that drop chamber filling up, you'll know it's not just math, it's nursing in action. Let's talk about a 72-year-old gentleman brought into the emergency department. His daughter is worried, and rightly so, because for the past couple of days he's been confused, sleepy, and peeing a lot. Today he's less responsive. The guy's got hypertension and BPH, and now his body's waving some red flags. Here's what you're seeing. Vital signs. His BP is up, HR is fast, temp is normal-ish. Assessment. He's dry, confused, barely peeing, 20 milliliters per hour, and he's got dry mucous membranes and poor skin turgor. Labs. Big problems. Blood glucose, 650 milligrams of sodium. Potassium, 3.2 milligrams. Bun, 30, also high. This patient is showing signs of severe hyperglycemia, likely HHL or hyperglycemic state, a true medical emergency. Let's go through the questions now. I'll give you a second to read and think before we dive into each explanation. Question 1. Recognize cues. Which finding should the nurse identify as the most critical cue requiring immediate intervention? Options. A. Blood glucose of 650 milligrams per deciliter. B. Sodium level of 150. C. Potassium level of 3.2. D. Urinary output of 20 milliliters per hour. Take a second and think. What's the most dangerous piece of information here? Correct answer. A. Blood glucose of 650 milligrams. Why? This isn't just high, it's dangerously high. We're talking HHS levels here, which can lead to coma and death if not treated fast. The other values matter, but we treat the glucose crisis first. Insulin's fluids equals life-saving. Question 2. Analyze cues. Select all that apply. Which actions should the nurse take when administering IV potassium chloride? Options. A. Verify the potassium chloride dose with another nurse. B. Administer potassium chloride via IV push. C. Monitor cardiac rhythm during administration. D. Check the IV site for patency before administration. E. Assess the client's urine output post-administration. Pause and review each one. What keeps our patient safe? Correct answers A, C, D, E. Why? Yes, this is a high alert med. Double check with another nurse. C, absolutely. Potassium affects the heart rhythm. Monitor that ECG. Yep. Infiltrated potassium can cause serious tissue damage. E, always check urine. If kidneys aren't working, potassium builds up dangerously. Never IV push potassium. That's a code blue waiting to happen. Question 3. Prioritize hypotheses. Rank the following actions from highest to lowest priority. Administer regular insulin IV per sliding scale. Assess neurological status. Start 0.9% sodium chloride IV. Correct order. 1. Administer insulin. 2. Start IV fluids. 3. Assess neurostatus. Why? Insulin saves lives in HHS. Then fluids restore perfusion. Neurological checks are crucial but not above stabilizing the crisis. Question 4. Generate solutions. You're about to give regular insulin to a patient with low potassium. What's the safest move? Options. Check potassium level after insulin administration. Administer insulin without potassium monitoring. Hold insulin until potassium is normal. Increase the insulin dose. Correct answer, check potassium level after insulin administration. Why? Insulin drives potassium into cells, which can drop potassium even lower. Monitor levels and give potassium as ordered. Don't skip insulin. The glucose must come down, but don't ignore the potassium either. It's a balancing act. Question 5. Tic-Tac spot. You're setting up the IV pump for fluids at 200 milliliters per hour. Where do you input this? Correct. Rate setting. Why? We need to program how fast the fluid runs. Volume to infuse tells the pump how much total. Start just begins the process. Alarm reset, fixing beeping, not flow. Right rate equal right hydration, right outcome. Question 6. Evaluate outcomes matrix. After 2 hours of treatment, assess if each finding is effective or ineffective. Finding effective, ineffective. Blood glucose decreases to 400. Sodium decreases to 145. Potassium increases to 3.8. Client remains lethargic. Why? Glucose down to 400, still high, but heading the right direction. Sodium normalized, fluids working. Potassium up to 3.8, that's solid. Still lethargic? Uh-oh, something's still not right. Maybe cerebral dehydration, lingering HHS effects, or evolving neuro issues. Needs follow-up. This case is real-life nursing. An elderly patient with underlying issues comes in altered, and we have to think critically, act fast, and monitor every detail.